Sup, pre-chiro students? It's Dr. Ben with another chiropractic student connection. Just aiming to connect with people in the real trenches that are in school, that are going through the process to help shine a light and provide you with some insight and expand your context on what it could look like to become a chiropractor. Today we have Zoe. Zoe, thank you so much for taking some time. Can you
Absolutely.
introduce yourself and just share a little bit about your background and upbringing before chiropractic and what attracted you to become a chiropractor?
Yeah, absolutely. So I'm Zoe. I am currently an eighth trimester student at Palmer Davenport in Iowa. Um, what initially attracted me to chiropractic took a bit to get here, but I knew I always wanted to help people. I kind of jumped back and forth from art therapy because I used to be like painting, drawing all the time. I'm more of a creative, right-sided brain type of person. Um, Went to psychology, pediatric psychology, and I was like, I'm too emotional. I can't do this one. Moved to physical therapy. And from there, that's kind of when chiropractic was introduced to me. I had a lot of pre physical therapy friends who switched to chiropractic. So I was kind of like, oh, okay, kind of started the conversation. They all went to Palmer Davenport, where I ended up. Um, but what really switched was I was shadowing my cousin for like 4 months because she is a physical therapist. And right at the end of the 4 months, a lady had came in with pain down the side of her leg. She checked her leg length, and it was probably about like 2 inches off. She did a pelvic maneuver manipulation. Not exactly sure what she did. It's so long ago. Um, and instantly her pain was so much better. And when she came back, this woman she wasn't able to walk some days for like 2 years. It was debilitating pain. And after that, she came back in a week and it was like 90% better. So I saw that and I was like, wow, that's so cool. That's definitely more chiropractic than physical therapy. And from that moment on, I was like, this is what I want to do. I love connecting people, especially with your hands. Like it's just so awesome to be able to have that connection. So really glad that I made this choice.
Mm, thank you. So, as a foundation, being an artist, and expressing yourself through art, can you talk about how that carried over into your chiropractic student experience? How that maybe helped you, and how that's sort of been a pillar in how you express yourself even through this process?
hmm So it's been a bit that I've been super creative. I kind of well, let me backtrack. So chiropractic school has definitely been a wave of ups and downs. I stopped doing the things that I loved doing when I first got there because there's so much studying you have to do that you just kind of put that first and then forget about yourself. So for the first year and a half, 2 years, I was working almost full time, trying to, pay my bills instead of just like letting the loans do it. I was like, I got to work, I got to do all this stuff. Um, and really kind of lost myself a lot with that. So after I decided, enough is enough, I basically burnt out and was like, I can't, sustain my life this way. I slowed down, forced myself to kind of listen. I meditate more. And now, just slowing down and allowing the creativity to flow, I've noticed my chiropractic practice is a lot better because of that as well. Because chiropractic is, letting innate do the work for you and really listening to the person's spine, listening to them and what's going on. And art is the same way. You don't think about what you want to paint or what you want to draw. You just do it. You just let it flow through you. So that connection has made it a lot better. And also the physical aspect of adjusting um, is easier as well because painting, using your hands to adjust, it is definitely an art. So they go hand in hand.
Hmm. And you talk about the physicality of adjusting. Did you have to get stronger or quicker or more in your body when you got into chiropractic school, or did you already have a foundation of working out or being an athlete? What was that like?
So I was also an athlete as well. I used to bodybuild for a few years as well in undergrad. So I have an athletic background, but it's definitely more finesse than strength. So I have had to work on getting quicker and more listening. I think listening and finesse. I don't think the people that force it and muscle through it, it's, not ideal.
Hmm. What were some surprises or challenges that you encountered with chiropractic school that you would like to maybe just share with some prospective students to help them understand, hey, this might happen. You just mentioned that you had to burn out and you stopped doing the things that you loved, but what was it about chiropractic school that was maybe different from undergrad or different from what you were doing before chiropractic school that really challenged you or surprised you?
I think for sure the schedule of it, going from undergrad and only having, a few classes a week and you have so much free time. And depending on the degree, my degree wasn't super difficult. It was disability and rehabilitation services. So it wasn't super like science based or anything, it wasn't pre-med or anything like that. So it might be different for other people, but for me personally, I had so much free time. And then going from that to basically a high school schedule again, where you're literally in class, 50 minutes of class, 7:30 in the morning to 2, 3 in the afternoon, but with a grad school spin on it, it's not high school level, is definitely a lot to adjust to. So preparing yourself mentally, understanding, all right, hey, I'm going to have to get up, I'm going to have to physically and mentally be there, because it's so easy to be in class physically but be somewhere else completely mentally. So that was basically the biggest challenge for me, I'd say. And also, yeah, just continue to do things that you enjoy. I can't stress it enough. It was actually a teacher of mine that had talked about that in a psychology class we took. She's like, yeah,
Mhm.
you guys, it was fourth trimester was when I took this class. And she's like, you guys get burnt out right about now. You kind of are probably feeling like you're a sailboat in the middle of the ocean with, you're right in the middle. You don't see the end. And she's the one that kind of was like, yeah, you probably stopped doing what you enjoyed doing. And I was like, wow, yeah, I did. I literally have no hobbies. So that's probably the biggest thing. Be prepared for the schedule and do not stop doing what you like doing. Even if it's 10 minutes a day, like, do not stop it. It's so important. You're going to want to put studies first. You're going to want to say that, you got to do other things, but you have to make that time for yourself.
Mhm. And where are you at in the program today? What are you currently working on? What's most important to you right now uh, in your path?
Yeah, right now things are great. I have been looking inward more, meditating, kind of figuring out who I am as a person and as a future chiropractor.
Mhm.
Um, Focusing on connecting with my patients and really just trying to be the best person I can be so that my patients, I can show up the best for them.
Mhm. So you're in student clinic. How much more time do you have left? Like, what are you working on right now besides the listening piece and the connection
Mhm.
piece?
Yeah.
What's important to you?
I just entered eighth trimester, so this is when I'll start to clear for outpatient clinic. I spent a trimester in student clinic. I'll be an outpatient for 2 trimesters. Come November, I'm moving to Marietta, Georgia, because I have a boyfriend that goes to Life right now.
Mhm.
Life is a great school. Shout out to Life. Um, and so I'll be precepting there, or peaking is what they call it at Life. So, and that will be until February, and then I graduate. So, just working as far as school goes, working on getting my numbers, working on getting X-rays and whatnot. Just credits pretty much in clinic.
Mhm.
I don't
Mhm.
have any classes. I think this upcoming trimester I have one final, and then I never have to take a final again.
Mm.
As far as boards goes, I know this weekend people are taking part two. I put that off a little bit because seventh trimester is pretty busy. So I'll take that in June, and then I'll have part three, four, and PT left.
Mhm. And what type of preceptorship were you attracted to go into? There's many styles of chiropractic. Can you discuss or describe what went into your decision-making process to pick the clinic that you picked, and what are you expecting or what are you hoping for in that experience?
Absolutely. So, in order to narrow it down, I used the Palmer Precept website that we have. And then I also went and looked at job listings in the area. Pretty much looked at the language they used on the website. If they only talked about pain, I knew it wasn't for me, because me personally, I think everybody should have chiropractic. I want it to be a preventative, wellness based. I want to wake people up. I don't want to focus on the pain and causing and getting rid of disease. So that was a huge thing for me, is listening to how they educate their patients and how they talk, and making sure that it was coherent with how I think about chiropractic.
Mhm.
The next step was I wanted it to be high volume because I want to own a high volume practice one day. So I wanted to learn from somebody who runs a high volume practice. Um,
Mhm.
and that's pretty much it. I still have to visit and kind of see the vibe of the offices, but so far I have 3 in mind. The docs are awesome. We've been emailing back and forth, kind of just trying to get to know each other a little bit, and
Mhm.
yeah, that's pretty much where I'm at.
No, that's great advice to like do your own research, go online, see what kind of language these offices are using to describe their care, their services, chiropractic. There's so many different
Mm.
ways that people are seeing what chiropractic is. And it sounds like you're staying true to the principle and practice of how it was originally intended and the roots. What are some of the influences or mentors you've had, or what are some of the things that you've really gravitated towards within the context of the program and maybe going outside of the program to attend seminars? Is there anything that you want to mention that was really helpful for you?
MLS with Dr. Wade Port and Dr. Jim Deegan was the catalyst for all of this, definitely. You have to go to MLS. The other seminar is Yoga of Chiropractic with Dr. Jeremy Brook. All 3 of those docs are amazing, super principled, sweetest people you ever meet, and they will hold you accountable and really make sure that you are being the best you can be.
What was it about, not necessarily the people facilitating those seminars, but the content and the substance of those seminars that was helpful for you in your process?
Yeah, it's so hard to put it into words, but the first MLS seminar I went to was last November. All 2020, I think, was really leading up to this moment. I had slowed down. I was starting to look in, kind of explore like my spiritual side of things, connecting with people. And when I got to MLS, they not only teach adjusting, but it's really more about you as a person and dealing with your past, so you can, and kind of exploring it so that you can rise above and level up.
Mhm.
So having the people there to kind of guide me and help me realize like what I'm missing, what I'm looking for
Mhm.
was huge.
Mhm. Mhm. And can you talk about that inward journey that you've gone on since going to that seminar, and how it's sort of led to your personal process? I know you said you're meditating more and you're looking within more. Are there any other questions you're working on, or any other practices that you've developed, just so that students entering into school might be able to get exposure early on, and might be able to tap into these types of practices from day one?
Yeah, absolutely. So reading a lot of books about spiritual laws or just spiritual ways of life. So for example, The Four Agreements by Don Miguel Ruiz, I think is the author.
Mhm.
Awesome book. I've been trying to live by those 4 agreements. So don't take anything personally. Don't make assumptions. Be impeccable with your word. Always do your best. Pretty much just trying to, like, if there's ever an instance where I have negative feelings coming up, I stop and I ask myself, like, okay, why am I feeling this way? Is it gossiping? Am I not being impeccable with my word? Am I taking something personally? Did I make an assumption and now I'm upset about it? Like, where is this coming from? So really taking a step back and meditating on life choices and how I got to where I am, stuff like that. Um,
Mhm.
Reading lots of books, but ultimately, another book. Side note: The Seven Spiritual Laws of Success. Huge, awesome book. So just kind of reading what other spiritual leaders are doing and trying to copy what they're doing is really, really all that
Mhm.
there is.
Mhm. Awesome. And so, how would you describe the type of practice you want to have? I know you said everybody needs chiropractic care, but how do you want to practice? Do you think it'll be open adjusting? Do you think it'll be individual rooms? And what types of messaging are you thinking of delivering through your practice in the future?
Yeah. All questions I've been really thinking about. I don't have all the answers yet. I'm not sure if I'll do open or closed adjusting, but I do like the community with open adjusting. So I think I'm leaning more towards open adjusting with some closed off rooms if someone needs some personal time with me. I'm also really into functional medicine. So I'll have a couple days a week where I want to do solely functional medicine for patients that want to explore that. But
What
also,
is that? Can you describe what is functional medicine? Because I don't think we've had anybody mention it yet on this podcast,
yeah,
but it's definitely something that's present on some campuses, whether uh, you want to go too deep into it, but you can go as deep as you want with just describing it, because somebody might really benefit from hearing what it is, at least.
absolutely. So functional medicine kind of takes nutrition to the next step. Instead of medicating for issues like rheumatoid arthritis or depression, anxiety, whatever the case is, it could really range from like neurodegenerative disorders all the way to just, not being yourself. And ultimately, I feel like it really kind of comes down to the gut. So, functional medicine really focuses on your gut microbiome, figuring out what imbalances are going on in your body, and using natural foods and supplements to rebalance your body so that you can kind of take care of the symptoms that they're having without just like masking it with a band aid and medication.
And what does that scientifically look like, you explaining to somebody, regardless of what their background is, like how I know you just mentioned like kind of generally what
Mhm.
functional medicine is, but like specifically if you're working with somebody, like how are you working with them, um, from a functional medicine standpoint? How is that different from medicine?
So you take a lot of labs pretty much, depending on the symptoms that they're having and what they present with. You might take like a fecal stool test, or you might take a blood test to test for food allergies. Um, and when you look at the labs and it comes back, it says like, hey, they're reacting a lot to this specific food, and this specific food, what's going on in their gut. And then you can see all the different organisms in their gut, and you can say like, oh, hey, all right, well, this microorganism is way too high. We need to take some of these probiotics to, even it out a little bit. Or hey, they have really high levels of Candida albicans, but their body's not reacting to it. So this tells me that they've been having this infection for a very, very long time, and it's affecting how they're digesting food and how their whole system really works.
Hmm.
So, yeah.
How does that relate to becoming a chiropractor to you, personally, and like how you want to take this degree that you're getting, this doctorate in chiropractic, and then use it to help people as much as you can? Um, what's at the root cause, or like why are you so interested in doing that as well as providing chiropractic care?
Three T's of chiropractic. So, for those of you that don't know, thoughts, traumas, and toxins. I feel like traditional chiropractic focuses a lot on trauma. So, that's kind of the easiest one for people to understand. Oh, I got in a car accident. I have this trauma to my neck. It hurts now. Can you help me? Can you adjust it? Um, but toxins is another huge thing. If you're eating Big Macs every single day of your life, you're not going to be able to adapt and, prevent subluxations. You're going to be subluxated and you're not going to be living optimally. So
Mhm.
being able to really look into that toxins component of the three T's and explore what's going on in their gut and in their body and fix that using whole foods and supplementation when needed, and take care of that third T.
Mhm, mhm. No doubt. And I appreciate this. I know that this is somewhat nonlinear and organic, but I think that that's the way that chiropractors are. We like to see how different connections can be made between experiences that people are having, and what's at the root cause of why they're having those experiences, and then also how our environment influences our expression, whether that be a healthy expression or a expression of dis-ease, lack of ease. So can you describe what it's been like to step into clinic now and start taking care of people as a student doctor or as a student chiropractor? What's that experience been like for you?
Being honest, it has not been what I thought it would be, given the fact that school doesn't allow you to exactly do everything that you want to do. So it's kind of like just get your credits, do what the school wants you to do, and then when you graduate, you have the freedom to practice how you want to practice. I don't know how it is at other schools, but with Palmer, it can be a little frustrating because in different classes, they'll teach different things. So, for example, in all of our technique classes, you have to wear a gown, it's skin on skin. But then when you get to clinic, if you want to do a gown and do skin on skin, people will get annoyed with you because it takes too long, and docs will tell you like just do it over the clothes, it takes too long. So it's like we're being taught one thing, but then when you go to practice and put it to use, we can't use it. Or in class they'll be like you have to have x-rays in order to adjust on these adjusting days. If you don't bring your x-rays, you do a mock setup and you don't thrust. But then when you get to clinic, if you need to get x-rays because it's warranted and the person needs them, it's like impossible to get the x-rays. So it's a little frustrating kind of working with like the different components and the contradictions there. But at the end of the day, it's about the patient.
Mhm.
And ultimately, I love serving patients. I love connecting with people. And that's really just what I focus on is like, you know what? It's frustrating, but it's not about me. It's not about my experience in clinic. It's about the patient on the table. And I think in student clinic, people forget that a lot because they're like, oh, you're just a student too. Like, you'll get here one day. You're my guinea pig. I'm going to practice when I get to clinic. And it's like, no, you should be practicing before you get to clinic because students are humans too. And if anything, they need like the best care because we are in the trenches, like studying like this for hours on end. And,
Mhm.
they really deserve the best care too. So
Hmm. If you were to reflect back on this experience, because you're getting to the end of the program, what are some things that, if you could change or if you can add in to the program, or if you could really encourage students early on and then even in the middle parts to go outside of the curriculum, to go outside of the program, what are some things that you really would love to see encouraged more or promoted more to students earlier on in their process?
the philosophy for sure. Going to seminars is also very, very important. And when people ask me, like, oh, should I go to the seminar? Should I get a table on their first try? I'm like, hell yeah. Some people will be like, oh, just wait, just wait. It's busy the first year. But I think it's so important to keep that fire lit and remember why you joined chiropractic school while you're going through some of your hardest classes. So doing that, but yeah, the philosophy is so important. For me personally, I fought it for so long for like my first year and a half. um, I don't know why. I don't know why I fought it because I clearly was not happy and I wasn't listening to my heart. I was disconnected from myself. um, but I always viewed it and I'm like, oh, half of me was like, oh, this philosophy stuff is so cool, and then the other half of me was like, I can't bring this stuff in practice. It's too like, ooh, it's too out there. Like, we got to be professional. And I kind of was viewing myself as like the natural medical doctor. And this past year, MLS, like thinking about what I was, you know, wanting to change, I realized, you know what? I don't know why I fought this for so long. This is what I believe. This is who I am. This is the principle of life. Like, everything makes sense. And it's not unprofessional to bring that into chiropractic whatsoever. And I'm not a natural medical doctor. Medical doctors have their purpose and their place in the world. So do PTs and everything else. But I'm like, I'm here to be a chiropractor, and this is what chiropractic is about. So I stopped comparing myself and I just finally let myself be who I wanted to be authentically. So philosophy for sure is huge. And it's sad because Palmer is getting rid of some philosophy. They said that they melded classes together and that the teachers in other non-philosophy classes are going to start talking about philosophy more. But the truth of the matter is they don't. And I can count on one hand probably the amount of times a non-philosophy based class had philosophy brought up in it. And there's probably one teacher that I had that kind of really brought it up even more so. And even then it wasn't taught to us. It was more of like a, hey, this is an extra credit question on an exam and it's philosophy based. So like, good job for doing your own reading and your own, you know what I mean?
Hmm.
So philosophy for sure, like get the green books, know your 33 principles. Um, yeah.
Hmm. Hmm. What are some big questions that you have that you're pondering right now for the future, and what's just like in your focal point right now for, that you're asking of yourself that other students might be able to relate to? Any questions regarding your future practice or regarding like skills that you really want to get better at right now or that you're trying to refine?
hmm So as far as skills go, I'm really trying to refine my side posture. I was doing it the way school taught for so long, which is like a Gonstead based side posture, and MLS does it completely differently. Um, so kind of relearning how to do it and learning how to keep the patient at ease instead of like bringing them to tension and just thrusting through the side posture has been a little challenging. Had a breakthrough at yoga of chiropractic the other weekend, so that's awesome, but that's definitely been my focal point as far as technique goes. As
Mhm.
far as the future, I've been kind of thinking about what I want to do for my own future practice. It won't be for a few years, so not like super focused on that, but more so just trying to silence my mind and really just trying to let the universe tell me and like listen more, like, all right, what do I need to do? Where do I want to go? Just more listening than asking.
Mhm. Mhm. No doubt. Yeah, it's getting familiar with the mechanics of how to provide adjustments
Mm,
in a way that is coming from a state of ease and coming from a place of peace and connecting dot to dot with the specific spots on the spine and having that level of specificity and connection in your hands and your heart. It doesn't come overnight. So just keep working at that and yeah, and take your time and make sure that you get people in their body to start breathing because a lot of the times people want to wrestle a little bit and it's like little cues are going to be the thing that helps. If you need any support, let me know. But yeah, I definitely have participated in MLS for many years now,
awesome.
not only as a facilitator but also as a participant. More so as a participant. I think I facilitated alongside Arno maybe 5 6 times, but
Awesome.
it's definitely near and dear to my heart. It's like you said, it's really a shift in consciousness of the practitioner, the chiropractor, to stop trying to do something to somebody and start to be in this dance where you're doing something with somebody. And it really is important that you focus on that now because to have longevity as a chiropractor and to not hurt yourself, you really do need somebody to let go
hmm
before you put in a force because the force application, if it bounces back, it could be damaging to the chiropractor if they're not listening, like you said. So um, thank you for shining a light on MLS. I think that it is super important. I would love some of the subtlety that's promoted in MLS to trickle out into the programs and into the way that students are introduced to adjusting. I think
hmm
that it's very fundamental. It's not owned by MLS. I think Arno just saw that there was some gaps and needed to fill them, and that's obviously evolved to other types of approaches like the yoga of chiropractic or the KTC brand of adjusting. I think that all came from MLS. So, can you talk just last message? I want to thank you for your time. Last message to students that are pondering their different options that are trying to figure out for themselves maybe what is the best path for them and why chiropractic should be a strong consideration for them.
Absolutely. So, as far as where they're at in school, I know that certain colleges have like I think it's like three to one program or something where you don't have to get your bachelor's degree to start chiropractic school. You can take their program. I think you do like a certain amount of credits. I didn't personally do it, so I don't know too much about it. I have some friends who did. And you finish out your bachelor degree later on in the DC program and get your bachelor's and your doctorate at the same time. So
Okay.
that's a good thing to think about if you're like, well, let me just save some time. If you're not in a rush and you want to have your bachelor's degree, because that's kind of a con to it is, well, if you go through the DC program and you realize, oh, this isn't for me, which I feel like it'll be for you, then you don't have your bachelor's degree and then you got to kind of like redo it. So ultimately that's an option. The path I took was I was pre-PT, realized I wanted to be chiropractor, looked at the classes I had and what I needed for the requirements, and then just switched to a different degree that had those requirements, which was rehabilitation and disability services. Switched that, transfer my credits over after I got my bachelor's degree, and then just kind of started at Palmer. I believe it's Palmer and Life specifically that have those programs. Life has an undergrad program that is like huge. Palmer is just a chiropractic, like getting into Palmer for chiropractic. So that's something to keep in mind. Chiropractic is such a rewarding field to be in. I cannot even begin to describe like the joy it brings. So if you want to help people as a student um, in the future, chiropractic is 100% the way to go. We don't treat disease. We don't look at a patient and say, here are all the things that are wrong with you. We look at them for the beautiful light that they are, and we show them, hey, this is how we can help you get, even to this next level. And when you're not focusing on disease and symptoms, it leaves room for like so much beauty and joy. So definitely rewarding. Can't recommend enough to anyone. So
And then just because you were in pre-PT, what was it that was like, how would you describe being a pre-PT student? Because we are trying to really develop a pre-Chiro program that's unique and distinct from pre-PT, but
mhm.
at the same time keep that structure that pre-PT and pre-med have been able to invest invest in and develop over time.
Mhm. So for the pre-PT program, it was a lot of science, anatomy, which I think is also helpful for chiropractic because you have a lot of science and anatomy that first year. After I switched, I never really got to the actual physical therapy classes, but I think in a pre-chiro program, having palpation would be huge because a lot of people, don't even feel a spine, especially now with COVID. There's people that have never even felt a spine and they're already a year into the program. So, kind of learning to use your hands, learning to listen to your hands too in a pre chiro program so that when they get to chiropractic and they can just focus on ups and adjusting, I think would be huge.
Mm-hmm. And then how about like just exploring the research or just getting really academic and like sort of upgrading the incoming students' awareness as to the different types of information that's available that's been put out by the chiropractic profession? Have you done any exploring yourself and tapped into any of the research out there or some of the organizations that are providing information in the name of chiropractic?
Yeah, so Dr. Heidi Havoc is huge in the research community. Her book Reality Check is awesome. Kind of talks about the science, proprioceptive feedback when you get an adjustment, how fast your adjustment needs to be. I think it's like zero point 0.2 seconds. And then Dr. Monique Andrews is also another. I haven't taken her Mo Knows program, but it's definitely on my list, and I've heard amazing things about that and the science behind the neurology of chiropractic and the adjustment. So those are two people right off the bat that they could look into and follow on Instagram.
Mm-hmm. Thank you so much, Zoe. I appreciate your time and your
Yes.
energy, and I know you're going to be great. If you need any support, let me know. I'm here for that. And yeah, we'll post some information for people to connect with you if any prospective students need help from you. And thank you so much. Have a beautiful day.
You too. Thank you so much.